And the next, just technical issue to mention, for those people whose English is not their first language, do look into the show captions option at the bottom of your screen. And there is the option of looking at translation that might help if it's in Portuguese, Spanish, French, and other languages. So that's something just to bear in mind. So, Louise, could you put the first slide up, please? Sorry, just the first slide. You go back one, Louise. Okay. Oops. Let's try again. So we'll just put our opening slides up and then we'll start.
Sorry, just a few technical problems.
Don't worry, don't worry. I'm not in control of the slides, fortunately, because I had technical problems before, but I'm sure they'll any second now. Here we go.
Can you see that?
Yeah, that's perfect, Louise. If you just put it on the slideshow. Look, it's fine as it is. So look, welcome everybody. This is the third webinar. We've got this slideshow now. Third webinar in our core global health program. And today's session is going to be on commercial determinants and research linked to that of relevance to oral health. Next slide, please. So what we have are two main speakers. We're delighted to have Sharon Friel from Australia, who has provided us with a video with the overview of the commercial determinants agenda. And delighted to have Kristen Kearns from the US live with us. And then poor Kristen, it's 6 a.m. in the west coast of the US. So it's super early, but Kristen's going to give her presentation on commercial determinants linked to oral health. And then I'm going to end with a brief opening of some of our initial results that we have found in research linked to our new program of research. So next slide, please, Louise. So the objectives of this session are really to introduce our audience to this topic of commercial determinants in relation to public health. It's not a new subject, it's been around for quite a few years, but there's a great deal of interest in this topic in the broader public health and global health community, and increasingly in the oral health community as well. And what we'll be doing today is looking into the broad concepts of commercial determinants, its application to oral health research, and as I said, we'll be giving you some interim new results from our global health project, where we have studies on this particular topic. So next slide, please, Louise. Just for some of you that are not aware of the core program, this is a four-year program of global health research, co-led by here at UCL and Carol, our colleagues in Bogota and Colombia. And within our program, we have three work packages, one on oral health inequalities, one on commercial determinants, the focus of our today's webinar, and the third work stream is on health system reform. What we've also got in our program is a very important program of community engagement, training, capacity building, which are core elements across all our work. Next slide, please, Louise.
Richard, sorry, could you please display the slides into the presentation mode, please?
Unfortunately, Marco, there's a problem that we'll finish off and then we'll do the video and we'll sort it out. But this is our last slide, but apologies for that. So Louise, if you just press the, so our core team are based in UK, where we have a team of researchers at UCL, Glasgow and Staffordshire, but also researchers in Colombia, Carol and her colleagues, in Brazil, Paulo and his colleagues in Recife in Brazil, in Kenya, Regina and her team in Kenya, and lastly, but not least, the team in India, Manu, Abhishek and Mirai in India. So they're the 4 partner countries where the research is taking place. So that's an overview of the core program. What we're going to do now is stop sharing the slide, and then we're going to show a video from Professor Sharon Friel from the National University in Australia, who is going to give a brief 15-minute overview of commercial determinants from a public health perspective. So hope you enjoy the video, and then we will move across to Kristen Kearns. So yeah, let's try and press the video, Louise.
Hi, I'm Sharon Friel from the Australian National University, and I'd like to speak about the commercial determinants of health, what that means in terms of global health, why it's an important research agenda. So the commercial determinants, we often think about them in relation to products or industries, and you can see here on this slide that actually the products of just 4 industries, fossil fuels, tobacco, ultra-processed foods and beverages, and alcohol, contribute around 1/3 of global deaths. So they really matter when it comes to global health. And on the left of this slide, you see it's much wider than just these products or these industries. So the gambling industry, the automobile industry, firearms, pharmaceuticals, and of course, there are many more. So if we think about global health and think about some of the factors that contribute to health and health inequities, it is really important that we understand, we study, and we act on the products and the practices of these different commercial actors across a whole range of industries. And this prompted this concern about what happens within the commercial world, prompted a Lancet series on the commercial determinants of health. And in that Lancet series, in the first paper, what we did was really just lay out a conceptual framework showing, as you see up here on the top left, a range of practices followed by the commercial sector, and I'm going to come back to these, which sit alongside what we already know in public health and refer to really as the social determinants of health, but these wider policy domains and governance domains and regulatory domains that we already have been studying and trying to act on, because we know that they matter a lot for health. And these interact very much with the commercial sector. And underpinning so much of both what happens in the commercial world and the broader determinants of health space are what we refer to as the system drivers. So issues of power, of norms, and of external costs that come from the interaction between commerce and the determinants of health. So let me just tease this out a little bit more, particularly in the commercial sector. So why does it matter? What do we need to understand about commerce, about the commercial world? And I suppose really, I want to say commerce is not a bad thing at all. But what is important to pay attention to is these things: the power by commercial actors to, of course, shape markets. That's their core business, if you like. That's how they make money. It's commerce after all. But they also have the power to shape the policy and the regulatory environments in their interest. And that's sometimes problematic, because we know that private interests are not the same as public interests. And then they also have the power to shape technological trajectories, or actually keep a focus on technological trajectories. And that sometimes diverts attention away from the broader context that matters for health, which is not a technological focus. So it distracts attention from where action is necessary to protect public health. And there's a range of practices that commercial actors use to do this, to shape markets, to shape the policy and regulatory environment, and to keep attention to technical solutions and responses rather than a wider response. And these are some of the practices that I'll just touch on a little bit, but you'll be very familiar with some of them. So, of course, we know that commercial actors use marketing. It works. They spend a lot of money, so it works. And this is just illustrative here of the marketing campaigns that have taken place by the tobacco industry, which we know is incredibly harmful for general health, for oral health more broadly. And what these marketing practices are trying to do is build a brand essence. It's trying to encourage people in particular demographics, you can imagine who's being targeted here, to want to either associate themselves with smoking, associate themselves with e-cigarettes. And sometimes they advertise in ways that you don't even know what the product is, such as the one at the bottom, Own Your World, Win Rewards. This is about making you, well, it's about making you want to buy stuff, but it's about making you want to associate yourself with a brand. And that also creates a brand image for the companies. Another way that commercial actors, the different practices that we use, relates to science, information, misinformation. Here is an example from Kristen Terrence, who, well, as you can see here, Kristen was really intrigued when she was at a dental conference and was handed a booklet by a doctor, so an authoritative figure, and about what dentists could tell patients who had diabetes. And nowhere did it say anything about reducing sugar. So here was science that was being presented to her, and nowhere did it mention anything about sugar to do with diabetes. And so that led Kristen down a track of really trying to uncover what was happening. And what she saw was the sugar industry influence in guiding science or misinformation in this situation. Another practice that companies, corporations rely on is reputational management, sometimes referred to as corporate social responsibility. And here I really put up these examples of washing, of greenwashing, of health washing. So Pepsi associating itself with doing the right thing, about trying to create a public image that was on the good side, if you like, where they were helping us during times of COVID, pointing towards where the testing site was. Of course, that's about trying to create an association of Pepsi helping us at times of real difficulties. But really, it's also about telling us that Pepsi is a good thing. You want to buy more of it. You want to associate yourself with it. That's about creating a social license to operate. The other example there is Shell, where Shell is it's about fossil fuels, obviously, and Shell was trying to say that it is really invested in alternative energy, clean energy sources, as they point here towards wind farming. And actually, it's really important to note that Shell, it's about something like 0.02% of their total investment is in clean energy sources. And they're still one of the leading companies worldwide for new fossil fuel projects. So what's happening on their socials around clean energy is really greenwashing. But this is about building reputation. This is about creating a social license to continue to operate as seen by the public, which also has an effect on politicians and policymakers and regulators. The same happens during, so this is International Women's Day. Diageo, one of the world's biggest alcohol companies, really try to associate themselves with women's advancement, women's empowerment, all about gender equity. And you know that alcohol is really problematic when it comes to things like domestic violence. So a problem here where alcohol companies are trying to get associated in our, again, from a public's perspective, with a positive association in some social issues. This is really about reputation management. Another practice that's used across universally is supply chains. So companies might own all the way from the seeds that grow the wheat that are used to produce the burger buns, for example, given the image that I've shown here. And they own that whole supply chain, that commodity supply chain, from producers to importers, the advertisers, the distributors as well. And that sits alongside a trading and investment regime, which is public policy, which these companies are very eager for trade and investment rules to be set up in a way that makes their global supply chains work the way that they want them to work, which of course from a commercial perspective makes complete sense. What that has started to mean, however, is what's called behind the border issues, where trade and investment policies or treaties have clauses in them that protect companies in those jurisdictions. It protects the way that companies operate in those jurisdictions. And again, in theory, that's not necessarily a bad thing, but what it does do, or what it can do, is hamper government's ability to regulate those companies in ways that ensure the public interest or that ensure public health outcomes. And that, of course, is it is a very contested area, that with companies working really hard to try and make sure that these trade and investment rules, which are legally binding, different to some other policy areas, that these trade and investment treaties are legally binding. So that is all about the market players or the commercial actors really having much more influence in government policy making. And that's got a whole suite of potential implications for social and health outcomes. Another practice that you may or may not be familiar with is financial practices that are used within corporations, within commercial world. So up here on the screen, just a whole load of different companies. You'll recognize the name of some of them. You can see a load of food, beverage companies, and some big agri-food industries in there as well. The thing I want you to note is BlackRock, Vanguard, and State Street. You may not have heard of them. These are big asset management companies. Basically, the investors put their money into, give their money to these companies, these asset management companies. And these companies invest across a whole portfolio of companies. And you see the range of investments that we've got across these companies, for example, these big major food companies. What does that mean? Well, that means that basically the shares of these companies are being speculated on the stock market. So that's about trying to make a return on the investment through the stock market. So it's really no longer about the food that these companies produce, but it's about the prices of the shares associated with these companies. And that does influence the focus of what the companies are about, because it's really about making short-term financial returns. And these asset management investors are also the same asset management, the same money managers across the fossil fuel industry as well. And I show you that because, remembering that the products of both industries contribute to the death, about a third of global deaths. Big food, big fuel, fossil fuels, big tobacco, big alcohol, major companies. So the behavior of these companies matter. And the financial investors into these companies have a say in what they do or don't do through their annual general meetings. So imagine if we were to influence the behaviors of those financial managers. There's still a lot to know about them. There's still much more research to do. And then the political is the final thing really that I want to say, the corporate political activity. They lobby, they set up think tanks, they sit on policy committees, all about trying to influence the policy and the regulatory environment. This is some work that has been done looking at the lobbying of harmful industries, tobacco, ultra-processed foods, alcohol and gambling in the US. And really, just the point to note is there's a lot of money associated with lobbying, either directly through the company or through company associations, but still much more to do to understand much more about these behaviours, these lobbying behaviours, and the influence of the lobbying on the politicians and the policy environment as a consequence of that. Of course, we think it's much more likely to lead to much more lenient policy and regulatory interventions to do with these types of companies. So to finish, what I really want to say is the market actors, for us, for global health, we need to have market actors that are operating on much more regenerative, ethical business models, business approaches that think about social and health goals as well, of course, as the financial goals. And the state actors and the civil society actors have a really important role to play. So as researchers, as NGOs concerned about global health, engaging in with governments, really, it's very important that we build up much more of an evidence base to do with the commercial determinants of health that understands about the power and the practices by these commercial actors, what that's doing to the policy and the regulatory space in ways that is either good or bad for public health. So thank you. I hope that's generated some interest in these commercial determinants of global health.
Brilliant. Well, look, that was an excellent overview from Sharon Friel. Obviously, that was a video, but if anyone's got specific questions, they can email me and we can get back in touch with Sharon. And the reason she couldn't be here live is because she's based in Australia, and the time zones are just too difficult in terms of managing to get that right. But hopefully you enjoyed that very broad overview of the topic area. What I'd like to do now is move on to our second speaker, Kristen Kearns, already alluded to in this presentation by Sharon. And Kristen's based in University of California in San Francisco and has established a real global reputation for her interest on commercial determinants and oral health. So over to you, Kristen, for your presentation. Thank you.
Okay, hello. Just want to verify my slides are up and we're good.
Slides are up. Good. They're perfect. Thank you.
Right. Okay. Hello, everyone. I see a lot of familiar faces out there, so really nice to see you all. Happy to have the invitation to share some of my thoughts on commercial determinants of oral health. Sharon actually already shared a little bit about my backstory. I didn't expect to see her slide there, but I do want to give you a little bit of my origin story on how primarily I started being interested in sugar in the sugar industry. And so I am trained as a dentist. I was working as a public health dentist back in the early 2000s and shifted to work in dental administration and was at Kaiser Permanente Dental Care Program working in operations when I attended a dental conference, and we had a keynote speaker that was from the US National Diabetes Education Program that handed out this booklet designed for dentists, how to talk to your patients with type 2 diabetes. And the diet advice did not say anything about reducing sugar. It was increase fiber, limit saturated fat and salt to control blood glucose. I thought this was incredibly strange. A second keynote speaker handed out his fast food guide to nutrition and used a stoplight system to rank things like fountain drinks. And I also noticed that he ranked Lipton Brisk sweet tea with 44 grams of sugar with a green light. And I chased him down and confronted him, and he told me that there is no evidence linking sugar to chronic disease. And I was completely stunned. And this was a major pivot moment in my career where I would come home after work and just start searching on the internet, trying to understand the sugar industry and if they had somehow impacted what I was hearing at this conference. And ultimately, this led me to the Sugar Association, which is a trade association based here in the United States in Washington, D.C. And this is a screenshot from their website back in 2007, where they're saying that natural sugar had been the subject of scientific scrutiny and that over 1,000 papers had dispelled the links between sugar and chronic disease. And they also cited an Food and Drug Administration report and 2 reports from the National Academy of Sciences that had concluded that sugar was not an established risk factor for any chronic disease. So again, I was just stunned. And as a dentist working in the trenches, feeling very frustrated that at the policy level, I felt like I'm being undermined, everything that I'm doing to try to improve health. And yet at the policy level, we're encouraging people to continue to eat sugar. So somehow I managed to discover confidential sugar industry documents in a public archive. And the first find was in Colorado. And as it turns out, this company, the Great Western Sugar Company, went out of business in the 1970s as high fructose corn syrup was gaining steam. And they donated their records to public archives. And those records had been screened by lawyers, but some confidential documents slipped through. And so these first documents that I found were from the Sugar Association. And as Sharon mentioned, wrote an article called Sweet Little Lies. And we were able to tell the story of how the Sugar Association influenced the US Food and Drug Administration to essentially exonerate sugar from being linked to chronic disease. And we detailed all their public relations strategies. This was back in 2012. And this was another career pivot. And so this led me to entering academia at the University of California, San Francisco, where I joined researchers at the Center for Tobacco Control Research and Education. UCSF is where we host the Industry Documents Library. And this started with the Truth Tobacco Industry Documents, which millions and millions of documents which showed us how the tobacco industry has worked to cast doubt on the links between smoking and cancer for decades and decades. And we were able to launch the Food Industry Documents Library back in 2018. So that original corpus of documents that I discovered turned into about 25 different archives that we located across the US and in Canada. And it also includes material donated from journalists that they uncovered during their investigations and other nonprofit organizations that have done freedom of information requests. So we have documents that span the time frame from about the 1930s through about the 2010s. And I'm going to share with you some of those documents related to sugar. But before I do that, I want to talk about flipping the script a bit when we think about commercial determinants of health. So Sharon shared with us this figure that the Lancet series on commercial determinants of health published that, we're all familiar with, sort of looking at the social determinants of health and the way we frame them, and centering population health or the public or the individual at the center, and then thinking about all the determinants and drivers that shape their behavior or shape their ill health. But after studying the sugar industry for so many years, I want to suggest that there's another way to look at this, and it's the way corporations think. And so the sugar industry has its own diagram here where they put themselves in the center, and they're mostly concerned with the health or the ill health of the sugar industry. And so I'm going to talk about this from the perspective of corporate ill health, because this is how corporations think, and it provides another framework to think about these activities and how they impact the determinants of oral health. So the primary sugar industry message when it comes to oral health is that tooth decay can be controlled without restricting sugar intake. They've been trying to convince everyone of this for more than 100 years. And then if we look at this figure that I've put together, this is just the business world, the business ecology of the sugar industry. So before they can get the public on board with this message, they also have to get the business world on board with this message. And so much of this has started literally over 100 years ago, back into the days of the U.S. Sugar Trust and the monopoly of the American Sugar Refining Company, working together with Wall Street sugar brokers, trying to promote positive messages about sugar and health. And they have to get the business world on board. So they have to reach out to their own constituents in the sugar industry, the cane and beet sugar producers, growers, refiners, trade associations. They look at industrial users of sugar. So this would be the Coca-Colas of the world, the candy manufacturers, even the tobacco companies who put sugar in cigarettes and pharmaceuticals that contain a lot of sugar. They're also concerned about competitors in the business world, like the corn industry and artificial sweetener industries. And they look for cooperative opportunities in the business world. So these would be larger trade associations like the International Life Sciences Institute that bring multiple industries together that have common interests. And then just the general business world, like the U.S. Chamber of Commerce that promotes business interests. So this is one way to center the sugar industry and think about their corporate and business environment. This is a map from the World Sugar Research Organization, which is one of those sugar industry trade groups, which then gives you a sense for the global connections of the sugar industry. So anywhere there's a flag, these are countries that have their own internal sugar industries that are globally networked through these global sugar industry trade organizations. And these organizations partner with other groups like the International Life Sciences Institute, and beverage companies, food companies may be members as well. So these are very powerful, highly networked organizations. So now I want to think about centering the sugar industry and the sugar industry's health and how they look at the general public. And so they're also surveilling risks like we do in public health, but they're looking at risks to the sugar industry. So here we've got in the center trade associations, the Sugar Research Foundation, Sugar Association, World Sugar, and ILSI that I've already mentioned. And they are looking and surveilling the general public. They're looking at the news media, now social media, books, magazines. They're looking at celebrities, authors, journalists. What are they saying about sugar? Are they saying negative things about sugar or positive things about sugar? If they're saying negative things about sugar, they're going to look at trying to shape their attitudes. They also look at the advocacy public. In the US, we've had the Center for Science and the Public Interest, which has been very anti-sugar for many decades. They look at scientific public, so they're scanning the scientific media. They're looking at what scientists and academics are saying. Also the professional public, so doctors, dentists, our own professional publications, nutritionists, dietitians, professors, teachers, they're also scanning for what we're saying about sugar and health. And then finally, looking at the policymaking public at the global level, national, state, and local, anyone with any kind of influence on government and regulatory positions, the sugar industry is surveilling and paying attention to. So with that sort of general overview, I'm going to dive into a specific example having to do with dentistry. I'm going to concentrate on the professional public layer here and look at us as dentists and how the sugar industry has looked at us as a risk to the health of the sugar industry. So let's start with how they talk about dental caries as being a threat to the sugar industry's health. So this is a document from the 1970s. This is a speech given by the president of the Sugar Association. And here he's saying that of the attacks on sugar, the dental caries area constitutes our greatest worldwide vulnerability. Caries do not necessarily kill, but they are common to everyone, and their cost to all walks of society is of major concern. I would venture to say that without sugar's implication in dental caries, our detractors would not have a popular case to peddle. So I found this interesting. You know, they're also concerned about obesity, heart disease, diabetes, but they were way more concerned about dental caries than I originally imagined when I first started doing this work. So this is an example of surveilling the dental science. So on the left here is a symposium summary. So this was sponsored by the International Sugar Research Foundation, symposium on the prevention of dental caries, reviewing the dental research. They held part 1 in Durban, South Africa. So this is a global effort. Part 2 is in Washington, D.C. They're bringing together sugar companies, but also dental science experts to learn from them so that the sugar industry can figure out how to shape their positive messages about sugar. And then the other thing they do is they survey the evidence base related to sugar and dental caries. Of course, this is pre-internet days here where they're keeping a card catalog, but the sugar industry hires their own librarians to search the literature and compile. And so this is an example of an abstract looking at diet patterns of dental caries in 3rd grade US children. And then what they're doing is they're applying a ranking system to these papers. Is it neutral to sucrose, positive to sucrose, or is it a negative to sucrose? So they're looking for threats in the scientific literature related to sugar and dental caries. And then they're also surveilling us, dentists, surveilling dentists' attitudes towards sugar. And this is an example, again, from the 1970s, where what the sugar industry does is they hire public relations firms to do public opinion polls. And they survey doctors and dentists and teachers and scientists and dietitians and nutritionists. And they want to know, are they anti-sugar or are they pro-sugar? And so here, what they found was that dentists display more consistently negative attitudes towards sugar than all other opinion groups. And at the time, the official position of the American Dental Association was aggressively anti-sugar. And they noted that the ADA had been supplying dentists with posters and literature urging decreased use or elimination of sugar and sugar-sweetened products, and that they had an active, ongoing television spot campaign designed to dissuade consumption of sugar, particularly among children. Again, a major threat to the industry. So another way of looking at dental professionals as a threat, this is how the industry was talking about dentists. Dentists were cited by almost half of all consumers as their source of information about sugar and health, which is a larger proportion than mention any other single source. So dentists have always been a target of the sugar industry, wanting to shape what we believe, what we say, how we behave related to sugar and health messages. So an example of what the sugar industry did in the 1970s to counter some of those anti-sugar messaging was to produce pro-sugar dental science. And this, again, was a global effort. They put together the series in the World Review of Nutrition and Dietetics, Sugar in the Diet of Man. I think it was a 7-part series led by Fred Stair at Harvard University School of Public Health. And in the dental publication, they've got the pro-industry dental caries messages saying things like, perhaps dentistry should be more realistic, saying it's not realistic to reduce sugar consumption, and really emphasizing the frequency message. Recommendations to discourage frequent use of sugar is more realistic. And of course, we know frequency is important, but this was minimizing that the amount of sugar was important. It's more about how you consume it, not how much. And this is still a debate that we have even today. And then, of course, they recruited pro-sugar dentist spokesmen. So here's an example of Dr. Robert Glass. saying that it's better to practice dental hygiene, use fluoride, and follow a balanced diet, which sounds good, but they're purposely leaving out the word sugar, and they're leaving out advice to reduce sugar. And then what was the impact on the dental profession at that time? Well, this is a statement from the American Dental Association on Sugar and Dental Health that came out in 1976 after this big public relations campaign by the Sugar Association. And now, instead of being anti-sugar, now they're saying that it's unrealistic to eliminate sugar from the diet. And here's a quote from the president of the American Dental Association at the time, where he's saying that current accepted dental research will not support the conclusion that a reduction in the consumption of sugar will decrease the level of dental caries. So here's an example of the sugar industry really targeting these professional publics, dentists in particular, and changing our attitudes from anti-sugar to pro-sugar. And I would say, this is just one limited example to the US and one organization, but this is a dynamic that's going on globally with the dental profession worldwide. And just one more example here that brings us up to at least 2015. And this is an example from San Francisco, where the city had proposed putting a warning label on sugary beverage billboards that would have said drinking beverages with added sugars contributes to obesity, diabetes, and tooth decay. And the American Beverage Association sued the city of San Francisco, claiming that there wasn't evidence to support the warning label, among other arguments. And as proof of that claim, they actually used the statement at the time of the American Dental Association, where they said that the ADA had similarly cautioned against the growing popularity of singling out sugar-sweetened beverages because the evidence is not yet sufficient to single out any one food or beverage product as a key driver of dental caries. And of course, the American Beverage Association was successful at overturning this warning label. So much of my work has been asking the question, why aren't dentists more engaged in things like sugary beverage taxes and supporting these things to manage dental caries? And I've actually been interviewing dentist leaders across the US for the last couple of years, trying to understand why we aren't more engaged. And so, I really would like to see dentists and dental organizations involved in the implementation of evidence-based sugar reduction policies. And I should say that there are many dentists out there and dental organizations that are involved, but we could be much, much more involved. And so, I want to know, is it because we're not capable? Are we not motivated? Do we not have the opportunity? This is an oriented framework using the COM-B model. I believe we are absolutely capable of doing this, particularly in the US, where we've taken on the water fluoridation issue. The dental professional organizations are there whenever fluoridation is being challenged at the state, national, local levels. We compile the evidence, we create spokesman groups. We certainly have the capability to operate in politically contested environments. Whether we have the money and the time to do it is another question. But I also question whether some of these sugar industry narratives have reduced our willingness to take on some of this work. And some of my initial findings from these interviews really just amaze me. In the US, there are many dental leaders who are unaware of the WHO sugars guideline. They're unaware of the US dietary guidelines with the limit on added sugars. They're still giving out advice about gulping down sugary beverages instead of sipping them, which speaks to the frequency issue, but we don't think about the fact that we're telling people to gulp down beverages. And then I think fluoridation kind of dominates and takes up a lot of our resources. Dentists are unaware of the evidence base supporting sugary beverage taxes and other policies, although most actually do think that it's a good thing to do. And then I just wanted to finish out by thinking through other potential commercial determinants of oral health. So we went deep on sugar, but we could do the same thing for other corporations that have an interest in oral health. So we could think through global oral health product corporations, so multinationals like Colgate-Palmolive, Unilever, Procter & Gamble, which dominate the global oral hygiene markets. And what are some of their tactics? Well, are they price setting, making fluoride toothpaste unaffordable in low and middle income countries? They're promoting branded products over public solutions. Their marketing is targeting aspirational identities like beauty ideals rather than health outcomes. We could look at dental supply and equipment markets. Although they're concentrated in high-income economies, they're aggressively expanding to Asia, Latin America, Africa. And what are some of the risks? Are they encouraging over-reliance on high-cost, high-tech solutions? Are they displacing locally adapted, low-tech public health approaches? And are they influencing curriculum design in new dental schools, especially the private for-profit institutions? Other considerations would be dental service corporations and private equity chains. This is a serious growth trend, particularly in the US. These private dental chains are often backed by venture capital. And what are some of the risks? Profit maximization over preventative care, use of aggressive upselling tactics on unnecessary treatments, and cherry picking urban and affluent populations and neglecting high-need, low-income groups. And then finally, a couple more, thinking about dental insurance and financing schemes. Some of the issues would be encouraging fee-for-service models that reward quantity over quality, exclusions and high copays leading to inequitable access, lobbying against universal public coverage for oral health. And then tech and data companies, emerging risks would be dental platforms collecting patient data with unclear privacy policies, AI-driven diagnostic tools, and commercial dental telehealth models may be bypassing public systems. So some considerations for corporate determinants of oral health, and I will stop there. Thank you very much.
Thank you very much, Kristen, for that excellent overview. Very, very comprehensive, covering lots of really thought-provoking issues. I'm just very conscious of the time. So what I'm going to do is, Louise, if you could put our slides up again. What I'm just going to do is very quickly finish off with some data from our current program of research. So what this is, and it links very much to what Kristen and Sharon have talked about. So our colleagues in Brazil, India, Kenya, and Colombia have been working on an initial study looking at the corporate political activities of the ultra processed food and drink industries. Next slide, please, Louise. So what we've done is systematically identified and described the corporate political activities of these industries in our 4 partner countries. And what we've tried to do is focus on sugar and oral health, but we have excluded the work around infant formula and infant food industries because there's different regulations, different issues in that particular space. So next slide, please. So what we've done in terms of our methodology is we followed a methodology developed by colleagues in Brazil. Milone and colleagues in 2015 looked at corporate political activities of industry, other food industries, and what they framed corporate political activities, similar to what Sharon mentioned, looking at information, messaging, lobbying, etc., financial incentives, constituency building, legal, policy substitution, etc. So that was the framework we used to categorize what corporate political activities could look at. And then the method we did to search for the information, firstly looked at identifying the major global or local national ultra food and drinks process actors in each country, sorry. We then systematically identified and searched through industry websites, university websites, professional associations, etc. We then collected the data, are currently analyzing it and synthesizing what we found across our 4 countries. So next slide, please. So firstly, and this is just one illustration from Colombia, most of the information we gathered on these corporate political activities were through industry websites. So a lot of these big companies have websites where a lot of information is presented. As Kristen has mentioned, there's also these industry organizations, either international or national level. Again, a lot of information available on those sites. And lastly, of course, increasingly, social media accounts from industry organizations also provide information for us to collect. Next slide, please. So initially, just to show you, across our 4 partner middle-income countries, the first important finding that we really identified is there's a mixture of trans-global corporations in the center of that slide that work across all countries. But also, very importantly, there are national companies, corporations that work at a national level. So in this slide, you can see the different corporations, both national and global, that we identified and searched through their industry websites, etc. Next slide, please. So just to give an illustration, this is just a sort of summary table of some of the data that was collected in this example from Colombia that shows the different industry actors in terms of the companies, and then the examples of the different type of corporate political activities that were identified. And what you can see here is a mixture of activities, for example, educational programs supporting disadvantaged populations, some examples of social responsibility activities, working with charities such as the Red Cross, foundations such as the Coca-Cola Foundation, working again in deprived communities. But the next slide, what we've done initially, because our analysis is still ongoing, is just to summarize some of the common themes of what we found from these ultra-processed food and drink corporations. What are the corporate political activities that we can see across our 4 countries? And what we've got here is the issue of social responsibility activities, and that's what Sharon mentioned earlier on about employment, environmental issues, sports sponsorship, etc. Financial donations to charities, again, a tactic used commonly by these industries. Partnerships with international organizations such as the Red Cross and others. We also uncovered opposition to making the case for self-regulation. So really putting forward the notion that industry can regulate themselves and regulation is not needed was a strong narrative emerging. There was examples of funding of research and into particularly nutrition and physical activity. There was clear issues of lobbying politicians and policymakers in opposition to plans to introduce sugar-sweetened beverage taxation and or front of packaging labeling, both of which were opposed by many of the industry partners that we identified. There was example of partnerships with local universities for supporting training, research funding, etc. So again, linked to Kristen's examples from the 1970s, this practice is most definitely still happening in our 4 partner countries. And lastly, there was strong evidence of strengthening connections between industry and policymakers to facilitate that sort of lobbying agenda. Next slide, please. So what we've done is we've just completed this first study on commercial determinants. What we found is a complex array of corporate political activities used by these industries across our 4 partner countries. Interestingly, there's limited direct focus on oral health. Most of the focus is on broader nutrition, public health issues that have an impact on oral health, but oral health directly is not something that is directly focused on in most instances. In terms of next steps, what we're going to do is continue the data analysis. We have a huge mountain of data to now analyze and report. And then secondly, we will be undertaking 2 qualitative studies in each country, interviewing local stakeholders about their awareness of industry influence on oral health policies, and then secondly, interviewing policymakers and other stakeholders about options for mitigation strategies to limit industry influence on public health. And lastly, this commercial determinants of research work links into our other pieces of work around inequalities, systems reform, and capacity building. So I think next slide, please. I'm just very conscious of time, but I would just like to acknowledge Janella, who was a PhD student of ours here at UCL, helped with the data collection in Brazil, in Colombia and in Kenya, and the local teams in Brazil and India who did extensive work collecting all the data and who have reported in their own countries. And I would just like to acknowledge that our project is funded by the UK National Institutes of Health Research. So next slide. I think what we'd like to do now actually is open up for any questions. Now we are unfortunately pretty tight for time, but does anyone have any sort of pressing questions? Because I do apologize, we've slightly run over, but we still have a few minutes for any questions either in the chat or in, if you want to raise your hand and you can ask a question directly. I can see Alex has got a question in the chat. Is there any research on the tipping point of sugar versus fluoride toothpaste? How much sugar is too much for regular toothbrushing? Well, that whole debate around oral hygiene versus sugar reduction is an ongoing one. I think my response to Alex would be, I think we have to separate fluoride and hygiene from diet, because the caries etiology is essentially driven by demineralization linked to sugar, to free sugars, whereas toothbrushing is really about plaque control, periodontal disease prevention, although of course fluoride toothpaste is an active ingredient in terms of protecting dental caries. So it's the fluoride in the toothpaste that's the key element. So that's where we have those issues. But David Conway, I've got a question.
Thanks, Richard. That was a really excellent session. Maybe a quick question for Kristen and Rich. And you may have answered this in part, Kristen. What is the barriers to us countering the industry's lobbying with politicians? I think you mentioned time, capacity, costs associated with that, but clearly the industry is in the lobbying space and it does need countered, i.e. with politicians. How do we engage with politicians to encourage more regulation, price policies, etc.?
Yeah, I think we need to strengthen from within the oral health profession. We have a lot of power that we're not using. And this actually speaks to another question in the chat about, are we siloing ourselves related to oral health with the sugar discussion? And what I want to try to get across is that we have been excluded from the conversation. Like the connection between sugar and dental caries is really hard to argue with. And so we should be upfront, participating, globally networked, talking with policymakers, putting out position statements. So just looking in the US alone at the position statements of various dental public health organizations and other dental professional organizations, we're all over the map about what we say about sugar and sugar policy. You know, we're still using outdated language. We're still using sugar industry messages. So we are not speaking with one voice from a global oral health perspective. And that's a huge missed opportunity. And so, you know, speaking to a group like this, you know, these are the people that need to come together and really work to change these policy statements and speak with one strong voice.
Thank you, Kristen. And I think this issue of silo is important, because looking at sugar as part of a healthy diet, we need to be integrated into public health nutrition and not work in isolation. So that, I think, is an important sort of message across nutrition policy for sure. I'm conscious of our time, but any other sort of pressing question? No? Well, look, I think we've covered a lot. Clearly, the recording will be available to everyone. So, because I'm aware me and Sharon have both got Scottish accents, and for those of you in different parts of the world, well, I'm looking at Alex, who's also got a Scottish accent, and David and others, but those of us who don't have a Scottish accent, you can listen to the video again, just to make sure you get everything you need from it. Also to mention, please do complete an evaluation form, and we can also provide CPD certificate, because all of us, not all of us, but many of us need those for our ongoing registration, etc. So we can provide that. And then lastly, we have got the next seminar, and of course I haven't got the slide in front of me, but we've got a forthcoming seminar, I think on
25th of
25th.
September.
25th of September. Thank you very much, Carol. Very helpful. 25th of September is the next webinar, which will be on oral health systems research. And our colleagues, Abhishek, Manu, and Paolo will be chairing that session, looking at oral health systems research, the 25th of September. And our final webinar in this series will be on the 30th of October, when we'll be looking at community engagement and involvement, an incredibly important part of our work. So that's the final webinar in our series, this first series, and that's the 30th of October. So look, apologies for running over by 3 minutes, but I think we've covered a lot. Hopefully it's of interest and stimulated interest in this important topic that's highly relevant to oral health globally, nationally, and locally. And I hope you have a lovely weekend when it arrives, and we will see you all again sometime soon. Thank you very much, everyone. And thank you very much, Kristen and Sharon, for their excellent presentations.
Thank you, everyone.